Welcome to the Explainer. Today, we are tracing the exact digital journey of a medical claim. We've moved way past the era of physical paper charts and messy handwritten notes. Today, we're going to look under the hood of practice management systems, or PMS, to see exactly how a patient's visit transforms into a secure digital packet of data, and how that data navigates its way to final payment. Modern medical billing and coding literally form the foundation of the healthcare revenue cycle, so understanding this IT infrastructure is absolutely essential for anyone working in this space. Let's dive in.
Here is our roadmap for today. We'll be hitting 5 key areas: the digital healthcare ecosystem, EHR and billing software, securing patient health information, clearinghouses as digital middlemen, and finally, open, closed, and isolated systems. All right, let's kick things off with Section 1, the digital healthcare ecosystem. This is the entry point.
So, long before a patient even sees a doctor, the practice management system handles the daily front office operations to establish the foundation for the entire revenue cycle. First up is the ID check. With insurance fraud and identity theft on the rise, providers have to verify that the person handing over the card is actually the insured member. Next, the staff verifies insurance, checking for copays, unmet deductibles, and network status, and they'll often collect those fees right up front. Finally, the patient sees the provider, which leads to clinical documentation, where the provider digitally records exactly what was done and the medical necessity behind it.
I absolutely love this quote because it highlights that front-end accuracy is just critical. The front desk staff are essentially the gatekeepers here. If vital demographic or insurance data is missing or entered wrong right at that first point of contact, it basically guarantees payment delays later on. It really shows how medical billing is a complete team effort that starts the second a patient walks through the door.
Moving right along to Section 2, EHR and billing software. This is where the heavy IT lifting happens.
Now, this is a crucial distinction. In the medical community, you'll hear EMR and EHR used interchangeably all the time, but they are technically quite different. An EMR is basically the digital equivalent of a paper chart. It's a closed system, accessible only inside that specific practice. An EHR, on the other hand, is highly collaborative. It's built for external exchange. To make that sharing possible, EHRs rely on universal health informatics standards, things like HL7 for system messaging, FHIR for modern web-based data sharing, and DICOM for medical imaging data.
You might remember this piece of legislation. It was the major catalyst that literally forced the healthcare industry to digitize. It mandated the adoption of electronic health records across the board. And the stakes were incredibly high. If providers could prove meaningful use, which is just the industry term for enhancing patient care through technology, they got financial incentives. But without adopting an EHR and advancing through those meaningful use phases, a practice simply couldn't survive the financial penalties.
In modern setups, the clinical modules of a patient's record integrate directly into the practice management system. This flow of clinical data automatically populates charge entry screens and digital superbills. So information like encounter times, personnel names, and diagnostic codes just instantly sync up. This drastically reduces manual entry errors and provides immediate proof of medical necessity, which is a total lifesaver if there are ever any legal queries about the treatment down the line.
All right, Section 3, securing patient health information. We have to talk about privacy and boundaries.
Before 1996, privacy was kind of a patchwork of state laws. HIPAA established the very first national standard, specifically utilizing the HIPAA security rule to strictly regulate how providers, health plans, and clearinghouses share data and safeguard protected health information, or PHI. It gives patients the right to access their medical data, and trust me, it is not taken lightly. Violations carry massive civil or criminal sanctions.
To actually enforce HIPAA compliance, the billing software itself acts as a digital security guard. It uses role-based access controls, or RBAC. This strictly limits what different employees can see based entirely on a need-to-know basis. So, for example, your billing staff might have full access to procedure codes and costs, but RBAC actively blocks them from viewing a patient's personal medical history. Conversely, a charge nurse might see all the clinical history but have absolutely no access to the patient's financial data or social security number.
Now, obviously, basic human habits matter here. Don't share passwords, don't write them on your monitor, avoid discussing patient matters in the lobby. You get the idea. But back-end cybersecurity is just as critical. Systems require strict audit logs to track literally every single user click and keystroke, alongside automated data backups and disaster recovery plans to maintain total continuous compliance if a breach or system failure ever happens.
That brings us to Section 4, clearinghouses,
the digital middlemen of healthcare.
So, what happens when a provider's software just doesn't speak the same language as the insurance company's software? It's a massive logistical problem. Providers use dozens of different systems, and payers use their own completely separate mainframes. They usually can't talk to each other directly. So, how do we bridge that gap? The answer is a clearinghouse. Think of the clearinghouse as the ultimate digital translator. It's a middleman business that receives the digital claim from the provider and converts it into a format the payer's system can actually read. Specifically, it batches internal practice data into HIPAA-compliant EDI formats, like the 837P for professional claims, the 837I for institutional claims, or the 835 for payments, ensuring direct, seamless transmission to the payer. But before firing anything off to the insurance company, the clearinghouse scrubs the claim. It acts as an automated proofreader, scanning for revenue code mistakes, clerical errors, and confirming that the procedure codes actually match up with the listed diagnostic codes. This editing step is a total game changer. It captures mistakes early, helping providers avoid laborious processing errors and outright denials later on. Once that claim is perfectly scrubbed, it needs to find its way home. The clearinghouse relies on an electronic data exchange, or EDI number. This number is a unique identifier for each specific payer. It's basically their exact mailing address on the digital network. By tagging the claim with the correct EDI number, the clearinghouse ensures it gets routed straight to the right insurance company for payment.
Finally, let's look at Section 5, System Architectures: Open, Closed, and Isolated.
Zooming out to the macro level, a closed system strictly forbids transfers out of its network. It is entirely focused on a specific internal operation, which is why standard EMRs fit right into this category. Open systems, however, are designed to make transfers between external healthcare facilities much easier. Because they communicate outwardly, providers have to use way more caution and tighter security protocols to ensure patient privacy is never compromised. Then we have isolated systems. These are completely separated from medical practitioners. Instead, they use personal health records, or PHRs, which are saved and managed directly by the patients themselves. While that is incredibly empowering for the patient, it's really uncommon to use standalone isolated systems for official billing. Legally, a PHR just can't replace an official health record unless it's integrated with the provider's open system.
So what does this all mean for us? Well, mastering this digital journey is about way more than just clicking buttons on a screen. Understanding how to capture demographics in your PMS, ensuring seamless integration, adhering to strict HIPAA protocols like RBAC, and properly routing EDI transactions is quite literally the only way to ensure practice remains legally compliant and financially viable. But as artificial intelligence begins to automate these clearinghouses and EDI formats, it definitely leaves us with a provocative thought. Will the role of the traditional medical coders soon be entirely obsolete?
That brings us to the end of our digital mapping session. Please like, share, and subscribe to Decode Healthcare with Harshal.